ARC Chair Module 8, Preschool Transition. This slide contains a link to information regarding early childhood supports and programs through First Steps. The transition process from an early intervention program to preschool can be a very anxious time for parents. As we all know, change can be scary, but also exciting. Children receiving early intervention services should be prepared to transition into preschool services by their 3rd birthday. The transition process starts up to 9 months and at least 90 days before the child's 3rd birthday. Kentucky recommends starting when the child is 2.5 years old. If the purpose of the meeting is to discuss transition from the early intervention program to the preschool program, the LEA shall invite a representative of the early intervention program to the initial transition ARC if the parent requests. This is always best practice, but you must have permission from the parents. The Kentucky Early Childhood Transition Project, in collaboration with the Kentucky Department of Education, University of Kentucky, First Steps, and Office of Special Education Programming, and many other agencies developed a resource to educate and assist parents in transitioning their children into preschool. Once a First Steps child has been referred to the district for special education eligibility determination, the evaluation team determines the need for instruction and interventions. If the team decides that there is no documentation that the child received instruction and interventions while in First Step that meets the standard of the regulation, then the evaluation team will develop an evaluation plan that includes the provision of instruction and interventions for a portion of the 60 school day timeline allowed for the evaluation. That same team will decide what the instruction and interventions are, who will implement the activities, and where the instruction and interventions will be implemented. The team must consider the settings in which the child already participates and what district resources will be used to provide the instruction and interventions. First Steps is the most common early intervention program in Kentucky. First Steps is required to provide research-based early intervention services. Progress monitoring also is required. Documentation should be available that can be used by the district as proof of prior instruction. Some information may be obtained from the service coordinator, but more detailed information may be available from the early intervention provider who served the child. For 3, 4, and 5-year-old children receiving interventions prior to entering preschool who are not transitioning from First Steps, look for documentation of the child's progress and interventions. A minimum of 3 data points is required. The documentation may include checklists or other data collection instruments that document how the child performed over time. Participation over time, including the dates of repeated assessments. If the child is receiving interventions 1 time a week, the interventions must be provided over time to give the child adequate time to respond to the interventions. If the child is receiving interventions several times a week, the intervention period should be long enough to give the child adequate time to respond to the interventions. The Transition Conference IFSP transition planning meeting usually takes place in the child's home, and an LEA representative must be present. This meeting is arranged by the First Steps program. The transition meeting will cover possible programs and services in the family's community. You will discuss the steps of transition, obtain permission to share records, discuss differences in service delivery models between First Steps and preschool, and the differences between an IEP and an IFSP. Once a First Steps child has been referred to the District for Special Education Eligibility Determination, The evaluation team determines the need for instruction and interventions. If the team decides that there is no documentation that the child received instruction and interventions while in First Steps that meets the standard of the regulation, then the evaluation team will develop an evaluation plan that includes the provision of instruction and interventions for a portion of the 60 school day timeline allowed for evaluation. That same team will decide what the instruction and interventions are, who will implement the activities, and where the instruction and interventions will be implemented. The team must consider the settings in which the child already participates and what district resources will be used to provide the instruction and interventions. During this meeting, the district must receive written consent from the parents to evaluate. After evaluations have been completed, the school district ARC chairperson will schedule a second ARC meeting. The ARC will determine if the child meets eligibility criteria for special education and related services based upon the information presented. If the child meets eligibility guidelines, a district may have to review the differences between First Steps and Part B services. Page 9 of the Step by Step, a family guide for transition into preschool, may be a good reference to use. If the child is found eligible, the IEP is developed according to the guidance document for individual education program development. If the child is considered ineligible, share community options or supports. The First Step Service Coordinator or the district's school's Family Resource Coordinator may be able to assist with connecting the parent with community resources and supports. The district must ensure that FAPE is provided in the LRE where the child's unique needs, as described in the IEP, can be met. A district may provide special education and related services to a preschool child with a disability in a variety of settings, including a public or private preschool program, community-based child care facility, or in the child's home. Implementation of the IEP will begin on the child's third birthday. The IEP must be reviewed 1 calendar year from the date the IEP was written. This concludes the module. Additional resources for the transitioning to preschool and the OSEP letter about RTI and delay of evaluation are included within the slide.